Have you ever been told that you are acting out during sleep, which means that you are punching, kicking, moving a lot, screaming, having a vivid dreams? If the answer is yes, you might have what we call REM Sleep Behavior Disorder or RBD. My name is Dr. Zayas. I'm a movement disorder specialist and I will be talking about RBD and what you can do. Let me start by saying that there is nothing benign about RBD. It is highly associated with Parkinson disease and dementia with Lewy body, and also with one of the atypical Parkinsonism syndrome called multiple system atrophy. In other words, if you have this problem, you better be checked by a neurologist specialized in movement disorder. Let me explain you briefly why this is abnormal and not benign. When you sleep, you have multiple sleep stages. One of them is called REM or REM, which stands for rapid eye movement. When you have dreams, you are mostly in this stage. So when you are in this stage of sleep, you are supposed to be paralyzed. This is a way that your brain protects you from having injuries or hurting your bed partner while sleeping. The only muscle active during this stage are the muscle of the breathing, the diaphragm, and the muscle that move your eyes. In some people, this protective system is not working well, causing them to act out during their dreams and potentially hurting themselves or their partners. These dreams are usually not pleasant. When you follow those patients with this disorder for years, the majority of them will develop Parkinson's disease, multiple system atrophy, or dementia with Lewy bodies. These problems tend to be more common in the last part of a sleep period, usually after midnight, which is usually when you have more REM sleep. Then the question is, how you confirm the diagnosis? Well, you need a sleep study. If I were you, I would see a sleep medicine doctor, preferable a neurologist, fellowship trained in sleep medicine. And if they confirm that you have RBD, then I will see a movement disorder doctor. Unfortunately, I have to tell you that if you have RBD and you have Parkinson's disease, actually that predict worse outcome. In other words, people with Parkinson's disease who also have RBD, REM sleep behavior disorder, they have more cognitive issues, more thinking issues, more mobility issues, and more walking problems. There are other conditions in younger patients, younger than 50 years old, when they have this problem, RBD, and the most common after neurodegenerative diseases such as Parkinson's disease and MSA and Lewy body is narcolepsy. There are other less common conditions that you see also RBD, such as MS, multiple sclerosis, stroke, sometimes tumors, and many others. One important detail is that sometimes medications might induce and probably unmasking or worsen RBD. Which medication I'm talking about? Mostly antidepressants, such as SSRIs. When I say SSRIs, I mean medications such as Zoloft, sertraline, escitalopram, citalopram, fluoxetine, and many others. But also SNRIs such as venlafaxine, duloxetine, which is Cymbalta, and also tricyclic antidepressants such as amitriptyline, nortriptyline. All those medications might exacerbate. It's like opening the door for this problem. Apparently, one that is less likely associated with RBD is bupropion. Okay. Another medication that might be associated with RBD is propranolol, and you will see the name in the screen, propranolol. Now, what we can do about this problem? If you are diagnosed with this disorder, the first thing that you have to do is just to see a movement disorder doctor. Sometimes you don't even need a sleep study because the history is very, very clear in many patients. And actually, sometimes I can see a video and the video is very characteristic, and sometimes I don't order a sleep study on those patients when the history is clear and we are just looking for RBD. Now, the first thing is safety. So I will give you some recommendations and I will put the recommendations in the screen so you can see that too. So number one is you need to remove furnitures, things that if you hit, you will cause yourself to have an injury, right? So remove nearby furnitures, remove sharp objects, weapons, and sometimes patients need to have a bed rail. It's usually soft. Then some people might lower the mattress. Some people actually sleep in a sleeping bag. Now, you have to do everything possible to protect yourself and your partners. Because if you fall from the bed and you have a dementia with Lewy body and you are a 85 years old patient, the probability of you having a fracture are higher. So do what you have to do to protect yourself and your partners. Now, if you are taking antidepressant, you might need to consider, assuming that you are stable emotionally and you are under the supervision of your doctor, is to decrease the antidepressants. So talk to your doctor to see if this is possible. Other option is to maybe switching antidepressants. So if you are taking, for example, Lexapro, you switch to bupropion. However, make sure that you understand that bupropion is not going to help with anxiety. Actually, might cause more anxiety. And if you have epilepsy, this is not a good choice for you. Now, if the symptoms are very severe and safety is an issue, then you might need to take another medication. The first choice is actually a supplement. It's a hormone and it's over the counter, and the name is melatonin. Now, how much melatonin? Well, you can start with only 3 milligrams, but some people require higher doses, and sometimes I go even to 12 milligrams. Make sure that you take melatonin at the same time. So when I say at the same time, if you go to bed at 10 p.m., you should take the melatonin 2 hours before or 1 hour and a half before. Okay, so you go to bed at 10, take it at 8, but it has to be at the same time always. Remember that melatonin is a supplement and not approved by FDA, so you don't know how much of melatonin is actually there. Okay, so I will tell you in the description of this video some recommendations that I have in terms of melatonin. And you should choose brands that undergo third-party testing. Also, I have a video about melatonin. Watch that video. The link of the video will be in the description of this video. Okay? Now, second choice, and usually many patients end up taking this medication because the symptoms are pretty severe. So this second choice is clonazepam. Clonazepam is a benzodiazepine. It's off-label as well, right? Off-label. You can start with a low dose of 0.25 milligrams 1 hour before bedtime. Okay? Avoid going over 4 milligrams. I rarely go over 2 milligrams. The majority of my patients with RBD are taking either 0.5 or 1 milligram. I only have one patient who is taking 4 milligrams. Now, be aware that clonazepam is associated with many side effects, including worsening of your memory, cognition, balance issues, confusion, daytime sleepiness. And if you have a sleep apnea and you don't treat your sleep apnea, clonazepam makes the sleep apnea worse. So you have to be careful. So make sure that if you have a sleep apnea, you are using your CPAP or BiPAP, whatever you are using for that. Okay. Sometimes we use rivastigmine or Exelon or donepezil or Aricept, which is a medication we use for memory to help the concentration, the memory in some patients. So there is some data that this type of medication might help with RBD, but it might cause more vivid dreams. So you have to be careful with that, right? If you like this video, don't forget to share and subscribe to my channel. See you soon.